Good afternoon, everyone. I'm Maynard Karkoff, and I'm Vice President of COPA and Chairman of Freedom Innovations. It's my great pleasure to welcome you to the webinar this afternoon. First of all, I'd like to say that COPA is excited about the opportunity to collaborate with AOPA to demonstrate their new O&P website and review how it can be used to stay current on all state and national O&P related issues. It's also my pleasure to introduce our speaker, Ashlie White. Ashlie is the Director of Strategic Alliances for AOPA. Prior to joining AOPA, she was the Director of Operations for Beacon Prosthetics and Orthotics. She also served as an executive board member for the NAAOP and as the Director of Government Affairs for the North Carolina Orthotics and Prosthetics Trade Association. Ashlie, thank you very much for making yourself available for this webinar. I've had the pleasure of working with Ashlie for some time in her various roles at AOPA, and she's always been a really strong advocate of the state organizations. And she will also share a little bit about AOPA and COPA and the other state organizations in increased collaborations going forward. So Ashlie, I'll turn the meeting over to you, and at the end of Ashlie's presentation, she will actually close out and adjourn the presentation, the webinar from her end. And this is the first of a number of webinars that COPA will be sponsoring. So we look forward to participating with everyone going forward as well. Ashlie?
Yeah, thank you so much, Maynard. It really has been a wonderful opportunity to partner with COPA on some of the projects recently. In addition to updating the state page on the co-op, which I'm going to share a little bit later, we've also been pulling some data from a resource that we have called Policy Reporter, which allows us to look at fee schedules, particularly for COPA, to look at the Medicaid fee schedule across the country, because that's some work that COPA is doing right now, and so AOPA's partnered to help provide some of that data. Also just continuously talking and discussing issues that are facing organizations, your O&P facilities on the ground. We want to make sure that that conversation is always happening, so that if there's something that AOPA can do from a national standpoint, that we are ready to do that. And so I have regular conversations with Maynard and Matt and several others in the state, and they're always keeping me up to date. So please don't hesitate ever to reach out to us if you see an issue on the ground, and we will loop in with COPA and make sure that we're all on the same page. I'm going to turn off my video so we can focus on the screen behind you. If at any point in time, if you can't hear me, or if the screen is no longer showing, please let me know, because that's the important content and I don't want to miss that. I don't want you to miss that. So I'm going to turn off my video now, and then you all let me know if there are any issues. I think the hand raising tool, or the ability to let us know if you have a question, also should be enabled on the webinar. So today we're going to talk about the co-op, and this is a compendium of all things O&P. So it focuses on reimbursement coding and policy, but we push out a lot of messages that we receive from people that are practicing in the field. And so we want to make sure that you understand how this works. You can reach out to me after the webinar and ask additional details, or if you want a online tutorial for your office, I'm happy to do that. Sort of a more hands-on demo, we can do that as well. But I'm going to give you a broad overview of the platform. This is the landing page, so what we call the home page, and there's some information here about how to use this resource. It also kind of gives a vision statement for what we hope this will be. We built this on the same computer programming platform as Wikipedia. So as we dive in, you'll kind of see how things link on the platform. If it's in blue, if it's highlighted, then it will take you to another page, and you can dig deeper and deeper into the content that way. We are constantly updating this platform, so everything on here should be accurate. If we roll across something during this presentation that has not been updated, then it's a sign that I definitely need to do some updating, but I am in the platform a lot. So if you have a co-op user login currently, if you're an AOPA member and you have your login, when you first log in, you should land on this page. And this will give you all of the most recent updates to the co-op. They're dated, so you can see how far back it goes. And this really is the most updated information that we have available at AOPA. You'll see a lot of updates to state pages, because those are updates that those state reps for AOPA have pushed to us so that we could provide those updates out to the rest of the membership. And as I'm going to just pop in here really quickly, this was an updated ankle, foot, knee, ankle, foot orthosis LCD, so local coverage determination. And one of the things that we find is that a lot of times people have to Google these, or they set links, you know, in a folder on their desktops. But what we wanted to do is provide all of this information in one place. So here's an example of a recently updated LCD, which we've linked directly to here. So you have access to all of the LCDs right there at your fingertips, and they're all in one place. So as we pop back on the platform, I'm going to show you how all of that works. So like I said, when you land on the page, you're going to get your activity update. You can also see popular. If you go under the popular tab, you'll see where most people are going, what pages that they're visiting most often. But we can dig into the content a little bit. And I think Christina has controls to questions, but please do not hesitate to stop me at any point in the presentation and ask questions. I want to make sure that this isn't just me talking at you, but we're able to have some interaction here if people have questions. So over on the left-hand side, you'll see a drop-down menu. This has all of the areas that are covered on the co-op. So we have a comprehensive section on Medicare. I'll show you how that drops down. It goes through everything from audits all the way down to competitive bidding information. We have Medicare as a secondary payer, and where the section that I was just in is the LCDs and policy articles. So one of the ways that our members are using this platform is for new employee training. When someone comes into your office and they've never experienced the orthotics and prosthetics profession, they know that they're walking into a healthcare environment, but it's a very different type of healthcare. And having all this information in one place can be very beneficial when you're training a new employee. So for this LCD and policy articles section, we actually provided the background information on how the LCD works, what it is, and why it matters to the orthotic and prosthetic profession. Here we link separate pages for each of the policy articles and local coverage determinations. So we were just in that ankle, the AFO policy article here. And one of the things that we've tried to do is break down all of the information that's in the LCD in terms that you can understand. So we take all the information from the document that you'll find on CMS's website, and we kind of break it apart and spell it out here. There's information about coverage, information about the requested documentation, information about policy-related coding. It really breaks that LCD down. And we find that this is much more approachable rather than having to send your employee to the CMS website and just look at the local coverage determination there. This is the information that we provide during the AOPA coding and billing seminar. So if you've ever been to a coding and billing seminar and you got one of those really fat books, this is the information that you'll find in that manual. And again, we really do try to break it down, even here, ones that are used during ambulation and ones that, devices that are used, that are generally used or not used during ambulation. So going back to the LCD and policy article page, you'll see that we have all the ones that exist currently listed, and those are updated as we receive updates from Medicare. So in the claims submission and billing section, there's a lot of information in here. So really this goes so deep. We wanted to provide as much information as possible. One of the questions I get a lot is, what about SNF billing? Well, we recognize that some of the common questions that we get all the time are ones that we have created these little diagrams for. And so we took these diagrams from the coding and billing manual and put them here on the platform.
And Ashlie, sorry.
Yeah. Mm-hmm.
So we actually have Paul asking, it said some timelines is critical to many of these issues. Can you tell us a little about how frequently the attached articles are updated and by whom? And he's particularly interested in updates for commercial payers.
That is a great question. So let me back out for a second and share the commercial payer section. So under our commercial payer section, what we wanted to do was create a place that would have information about our biggest payers, but also would allow us to kind of document things as they happen. So the Blue Cross Blue Shield page, we pushed this alert recently, actually back in October, when we saw that there was a really tough pending policy. At the time it was a draft policy. We gathered every group in O&P. Our O&P Alliance is made up of the Academy, AOPA, the Academy, NAOP, ABC, BOC, NCOPE, and the Amputee Coalition have strategic partner roles on that in that coalition. And we asked them all to send letters to thwart the possible publication of this policy. So this is how we're currently using the private payer policy portion of the co-op. Most often, these messages are also going to be pushed to those state pages. So I'll show you where else you can find those here. And when we push in a policy of concern to the co-op, it's because it really has a high level of change. So the update itself is marked as high, like high level for the amount of criteria that has actually changed within the policy. We didn't start doing this until the beginning of last year, actually it's in May of last year. And so those policy updates are anything that's happened from the beginning of last year till now. So it doesn't go back. If the policy hasn't been updated in a few years, we will push the update out if it is of concern. And I can actually share with you all how we do that. So pardon my bouncing around a little bit, but this can give you some information about how we get this. Policy Reporter is the platform that we use to look this information up. And those policy updates will show up in the database. We can look up any of these categories, but our services fall under orthopedics for most payers. And it's separated out by bracing and prostheses. So even though these aren't the terms that we use in our own profession, it's what payers define for us. So if I go back to January of 2019 and just search all payers through now, it'll give me a comprehensive list down here. You'll see the search results of all the policies that have changed. You'll see on January 1st of 2019, here's the change summary. So it actually says no changes to criteria. And I think the reason that they marked this as high level change is because there was changes to the prior authorization list. And so that does affect reimbursement. The change summaries the levels of the change summaries are based on how much it will affect your business. So if it's high level or low level, that's how much it really affects reimbursement. One of the cool tools on here, I'm actually going to go to some of the more recent updates. Go to page 3 here, and I'll show one there was just a recent one from Pennsylvania, no, New Jersey, sorry. So this was actually, there's a significant section that has changed in this policy. And what we're able to do is do a side-by-side analysis of that change. So we can pull up the policy and look at them side by side and see what's actually changed. Everything in yellow has been changed in some way. And what you'll see here, what section has changed the most and why this was a high relevance update is because the rationale section has changed. And so you'll see this is what has to be in the patient's medical record in order to qualify for microprocessor prostheses by this policy. And that's incredible information for your practice, obviously, because if you have this information, then you're actually able to abide by their requirements and get your prostheses approved for your patients. So we recognize this, and we recognize the power of this tool. And as AOPA members, all you have to do is call me or email me, and I can provide these change documents to you if any policy in your area is affected and you're concerned about it. Does that answer the question? I hope it does anyway. So I kind of gave you some this is back end. So this, AOPA pays for this, for access to this portal. And then we push out the information to the co-op, which any AOPA member has access to. And we try to do it for as many payers as we have information for. So when we see something, like I said, it has to be a big change to the policy for us to be able to push it out. Oh, I've got a question here. I think I can actually see them. Oh, let me see. Who aggregates the policy? Okay, so Policy Reporter is a service that we pay $18,000 a year for. AOPA pays $18,000 a year for this service. And this service is used by a lot of companies. So everything from big pharma to big hospital organizations use Policy Reporter. Several large O&P facilities in our space have also used this service in the past. We find that the updates are pretty regular. I would say, I mean, I get a report every week. I'm going to get super into my email here and show you a Policy Reporter update that I received today. So please don't look at my subject lines here, but I can show you the one that I received today. So this is the email that I got from Policy Reporter today. I don't know if y'all can see that. So it just gave me that the cranial orthotic devices for positional or deformational plagiocephaly policy had been updated. I get a digest email like this every day that lists out policies that have changed. How confident I am that they're doing it in a timely manner, I really, we've only had the service for about a year, and I do think, I think they're pretty timely. I don't really have anything to measure it against. Insurance companies are not required to report policy changes to Policy Reporter. Policy Reporter actually scrubs the mechanism that makes Policy Reporter work is an online spider tool. It's a information technology tool that allows them to scour the internet and find all published policies. And then they do have relationships with payers on the back end. So Blue Cross Blue Shield is a payer that they are currently linked in with and have access to. So we know that some insurance companies' policies are going to show up more often than others because they have relationships with Policy Reporter. But the mechanism that allows them to trigger the update is if that update has been published. So no, they are not required to report. And one of the things that we're seeing happen more often now is that these insurance companies are using third-party entities, claims processing entities and other types of entities that are using proprietary coverage documentation. And so when we actually request the coverage documentation, these third parties, entities ask us if we have a membership with them or if we, are subscribing to their service, and which puts a big challenge with people having access to their healthcare information. So part of one of our focuses is actually making sure that people have access to their own information about their healthcare coverage. It's one of the problems, I think, in our space. So separately, we're working on that issue as well. Okay, keep the questions coming. I like it. So I'm just going to pop back over to our list of pages here. Oh, got one more. Let's see. Okay, so Paul asked or says that this leads to an interesting question of commercial insurers are required by their state insurance commissioners to publish changes to their policies. You know what? I think that's a great question, and one that I can definitely carry back to the office with me and make sure that we ask that question, because I think it's an important one. It's hard to oversee an entity as an insurance commissioner if they don't have to reveal any information to the insurance commissioner. So that's a great question, Paul, and one that I will definitely write down and take back to the office with me. Please keep them coming. So we were in Medicare, but obviously we've shared some of the commercial payer section with you all as well. Are there any questions? So like I said, for training purposes, we really did a comprehensive gathering of the glossary of terms for orthotics and prosthetics for the profession specifically. But we also added these in the VA section and the DoD section, and some of the private payers have their own glossaries. And so where we found separate glossaries, we attached them, we added them in here. So under the VA, there's a VA and DoD definition section. The VA just uses different words. They define things differently. And so we want to make sure that you have access to all of that information as well. I don't see any open questions. So we'll keep moving. The other things that we have, an area I'm excited about for VA and DoD, we created a way for you to look up your VISN information because the VISNs are the Veteran Integrated Service Networks. A lot of people don't know about their VISN or how the VA works with respect to the provision of orthotic and prosthetic services. There are only 7 centers of excellence that provide internally full range orthotics and prosthetics. A lot of the areas of development within orthotics and prosthetics in the VA are vastly different. So we see a lot of disparities or areas where the provision of services is different. But what we wanted to do is provide information about those VISNs and then allow people to find the clinics that actually offer prosthetic services there. So we scoured all the information we could find and we linked information about the VISNs, and you can go to the main network or you can look at the individual centers, and where we have additional information on practices that actually, or O&P clinics, we've provided that information as well. So we're trying to put kind of information that you might have a question about or need to know on this platform. And we even created a little section to announce contracts that it's public knowledge. They're announced through the fedbiz.gov website, and so it's publicly announced. And so we've just started every 30 days. We will be pushing those announcements. So we only check it every 30 days, but every 30 days I check and then I push new announcements to the VA page on the co-op. So that's some information about the VA and DoD section. And again, as we continue to work and collaborate with different organizations, we have a project that we're working on with DoD right now. We will provide as much information as we get to you all so that you're looped in as much as you can be. I think that, yeah. So we also, if there's a call to action, if there's a proposed rule, there is currently one that has been sitting out there in the world for some time now, we push that information so those alerts will come out. Now, I've been talking a lot about alerts, so I want to give you information about how to receive those alerts. So once you've signed up for the co-op, you can watch any space on the co-op by this little eyeball here. You can watch this individual page, or you can watch the entire space, which is everything that gets published to the AOPA Co-op. Now, if you're watching a space, every time I make an update, you're going to receive an email. And that email will be a change document for what I've actually changed on the page. So you won't ever really have to log in if you're following the whole thing. But it does benefit to log in sometimes because you can get additional information that you might not otherwise find in the update. Sometimes I'm updating just to link to a new page that I've created. Some people, when they get to work in the morning, they log into the co-op and they have it as an icon on their desktop. And we see that they're in, just from our analytics, that people are on the platform all day long and they use it sort of like a resource tool while they're working. Some people only log on once a month because they're just getting the information that they need when they log on, and then they get off, and then they see another update pop up and they can get on when they need to. So you can really use this tool in varying degrees in any way that it serves you in your practice. So the state matters section, this is kind of what going into that information that we were talking about with COPA. If you're on the California page, you can see updates to the the work that's been shared with us from COPA, and we have information about COPA here and updates that Matt provides me from COPA that I can then push out to the co-op. We are also, we've been tracking the California policy updates, but what we've seen is less and less policies from California, imagine that, are being published. And so we just don't see very many published policy updates right now. If I went to the California, a lot of administrative changes, but not a lot of medical policy changes. So I don't know if yep, I closed it out, but when I was in the policy reporter, there's also a way to look at the map of the United States, and California regularly has the least number of O&P or orthopedic specific bracing and prosthetic updates. So this is an area where we can push information, like I said, for you all to have, and this is as interactive as you want it to be. So at the bottom of every page, there's a write a comment section, and those comments come directly to me and two other people on the AOPA staff. Any information that is submitted to the co-op goes through our reimbursement department, so that would be Joe McTurnan and Devin Bernard, and is ultimately approved by our executive director before we actually put it onto the co-op. So in situations where I've been working closely with an organization at the state level like COPA, we can push out COPA updates because those have already been approved. But if someone is saying, well, actually that information is wrong, or there's new information about a policy you should be publishing, that will go through every relevant person on AOPA staff to make sure that that information is vetted before we push it out. And we do have a page for every state, even some of the states that are not very active. We're hoping to engage individuals in those states and get people more active. The more information we're able to share with each other, the more accurately we can respond to issues accurately, efficiently, effectively when those issues arise in our own states. I see a question. That's a great question, Paul. So when it first started, I feel like we were sending a lot of we had a content committee, and that committee included Mitchell Dobson from Hanger, David McGill from OSER, Michael Oros from Sheck and Cyrus, a group of individuals in the field, and that was our content committee. And at first we had everything run through that content committee in addition to the staff at AOPA. Now that we're a couple of years into this platform, we no longer run it through the content committee. So it usually gets published once someone sends me the information. It usually gets published by the end of the day, depending on what time I receive it. So if Devin and Joe are still in the office and I'm able to clear it through them, most of the time Eve, our executive director, is going to approve it. We have a strong leadership team, and everybody gets to see it, and if there are no concerns, it gets published. Thank you, Paul. That's a kind compliment. This part of my job, I have a kind of a range of things that I do. I oversee our research spend, so I'm not a researcher, but we are doing a lot of funding of research and our prosthetics and orthotics 2020 projects. And this part is actually what keeps me connected back into the day-to-day O&P facility. I miss that. I miss that on the ground. So I enjoy being able to see sort of the daily changes that affect your businesses. It's stuff that mattered to me when I was when I owned a practice, and it matters to me still. So I can provide that information to you all. And we have a great team. We do have a really great team at AOPA. So I'm excited about, you know, being able to provide this resource for you all and being able to work so closely with COPA over the past year. It's been really, really great. We are opening up new sections in the good practices section here. We just started a member to member kind of resource. We want to encourage our other members, if they're developing tools that can be used. Obviously, there's a disclaimer here because this is not AOPA created or AOPA generated content, but we want to share resources from our members. So our membership is broad. AOPA represents suppliers, institutions, and O&P facilities. And so if you have a tool that you want to share with the world of O&P, we are happy to publish it here. And this is brand new. So we created this page back in May, but we just rolled out the kind of outreach to get the information back into the system. So we're excited about this too. It's brand new. And we have a forms library. This is not going as well. This is one area where we should be growing. We found a lot of Aetna forms that we could, and resource pages that we could publish. And then when we tried to get it from the other payers, we had a hard time finding the forms. And so if you're able to log in to the back end of these organizations' websites, it's a lot easier to get it, but because we don't represent an O&P facility, we're not able to do that. And so we've had a harder time than we thought finding forms. Something that we fully intend to continue to work on though. We did create a charitable funders page, so we will be updating this with new charitable funds. So if your facility is looking for a way to help someone get a prosthesis, this would be a great resource for you to use. It looks like we have a question in chat. So it says, I currently have a proposal to CMS to cover compression garments used in the treatment of lymphedema as a prosthetic device benefit. You know, I think this actually has been introduced to us before. Thank you for sharing this with me, and I will pass this along to the reimbursement team. I know that Joe had mentioned this to me in the past. So yes, definitely we will pass that information along, and thank you for sharing with me. I don't personally know right now if we have any involvement in it, but I'm sure we will be interested in any of your efforts, certainly. So are there any sections? I have an idea. So one of the other tools that I really like about the platform, and one of the things that I think is the most useful, is if you use the search function, it's incredible. It's only searching this internal platform, this internal database. So it doesn't pull from anything else. And if it will tell you like I'm just going to look up cranial, it will give you every reference to S1040 on the whole platform. So here it's going to be, this is in our L code search tool. Another tool that we're about to roll out is here where you see details. We are offering to all of our members that they can actually link to some of the, this was all pulled from lcodesearch.com. As we've seen that platform has started to deteriorate, just the coding that was built, the computer programming that was used to build lcodesearch.com has started to deteriorate. So we imported everything over to the co-op, and now we're going to reach out and allow suppliers, manufacturers to link direct links to their devices through this search tool. So if you're in spinal orthoses, over here in the details section, you'll be able to, this will be linked directly to a product that's provided by one of these organizations. We also have to scrub this information because like I said, we just imported it over from the lcodesearch.com, and we've got Devin and Joe are doing the scrub on it before we link any of the information from the websites. So if you're working on building a compliance plan for your facility, we've added a document here on building a compliance plan. We also have a lot of the topics and issues that you need to consider in building your compliance plan. And we link to a lot of the agencies that oversee fraud and abuse for the system. So we've put a lot of the information on here. If you've ever taken one of our compliance courses or webinars at AOPA, that information has all been imported here into the compliance section. So with Medicaid, this is probably one of the most difficult sections to update because the Medicaid programs change so frequently, or the resources that they use and the links often die. And so as we had originally posted different Medicare policies, we found that those were changing, or the links were becoming inadequate so often that we decided to allow you to go directly to the Medicaid site. This is just where you'll find the information that you need. You can obviously Google this, but at least it's here. So if you're thinking Medicaid, you don't have to Google to find where you need to go. We've put this information here. Now, when we get Medicaid updates that are of concern, we absolutely push those. And we do the same for workers' comp. So Delaware last year had an issue with their workers' comp. They cut the line item by 20%. That was the DME-post line item. So in the state of Delaware, DME and O&P are included all together. And we had to fight that. We wrote letters for testimony for that effort, and worked really closely with our state rep in that state, and we were able to get that reversed. So it went back to the normal workers' comp fee schedule for the codes that are associated with orthotics and prosthetics. They had to make the cut. It was a law that required them to make that cut to the program, but we were able to create an exemption for orthotics and prosthetics. And those are the kind of efforts that AOPA is always ready to engage with. If it's going to affect your business, we're hoping to be able to jump in and provide letters of support or letters of concern or testimony when it's relevant. So we've done a lot of digging. Are there any questions about information on the platform that I can answer? Or areas or sections of the platform? No more questions? Okay. Well, I'm always available. My email address is awhite@aopanet.org. My direct number, my direct line is 571-431-0812. And feel free to reach out to me if you have questions, if you want to chat about the platform, if you need to get signed up for it. Oh, look, we've got a question. Are there limits to oh, this is a great one. Are there limits to the number of employees who can access the site? So we pay for the licenses per license that are on the co-op. AOPA does. And we offer every member a free license. So that means one free user. And a lot of facilities will share that username and that login information if you have multiple facilities. So if you have affiliates under your main patient care facility, each of those affiliates will also receive a license. But we aren't able to offer individuals within a practice their own login right now. Once the platform expands, if we're able to, they actually cap the licenses per, this service is called Confluence, and the number of licenses is capped. And so we are concerned that if we offer one company 15 and another company needs 200, that ultimately will hit our cap and we won't be able to provide the same for every member. And so we've capped it. And again, we have to pay per license, so that that limits us. We have been offering additional licenses for facilities for $20 per license, and that is tagged on to your annual renewal. So if you would like to get multiple licenses, you can, but there is no limit to the number of people that you can have log on with one username. We've done this in our live room at one of the seminars, and 16 or 17 people logged on at the same time and no one got kicked off. So we're pretty confident that many people can use it at the same time. Any more questions? I really appreciate all the questions, and I appreciate you all having me on to share this resource. Obviously, I'm excited about it because I'm in it a lot. I'm working on it a lot. And I hope to expand it even more. If you have ideas about information that you'd like to see on the co-op or things that you think will make it more comprehensive, please share those with me. Those thoughts are always important. And again, you can comment directly on the co-op if there's a question about any of the information that we've provided.
Say, Ashlie, this is Maynard. Can you hear me?
Yep.
I wasn't certain that I'd have access to the audio visual at the end of your presentation, but it switches back pretty easily. And so I just wanted to extend our thanks to you for all your preparation and your presentation. You're always an inspiration to talk with. You are always extremely knowledgeable and always very helpful. So we're really honored to have you make this presentation for us and to be collaborating with AOPA. I'm not sure how many of our members know the level of cooperation that has begun between AOPA and COPA. You might want to share a few words on it, but I would just say at the onset that the collaboration is deepening. And I think it has always been available. We're just working on it more intensely than we have before. Yeah. And we have the AOPA annual meeting in San Diego this September, which provides sort of the platform for the perfect collaboration. And so we are doing so to help provide content and help increase attendance, etc. And if you would share a word about the collaborations from your perspective.
Yeah, so I think you're absolutely right. The annual conference, our assembly, the AOPA assembly, in conjunction with the COPA annual meeting is perfect because it allows us to tap into all of the attendees that would normally be attending COPA and may not normally attend the AOPA assembly. Likewise, we get more people that might not be linked in with COPA and should be considering joining COPA. We get that crowd too. So it really is an opportunity to link everyone together, and COPA's going to have a big presence at the meeting, and we're excited about that. Personally speaking, if I take my AOPA hat off, I think about state collaboration or state efforts because I was part of one. So in North Carolina, we didn't have an opportunity to wait to get national assistance on some of our issues. We saw that Medicaid was being cut for adults. We formed and I say we, it was really my father, but they formed a group called NCOPTA, the North Carolina Orthotics and Prosthetics Trade Association. They went to the Capitol and they said, you can't deny people access to these devices, and that was that. And that is the kind of thing that COPA can do for the O&P providers in California. It's not something that, I mean, sometimes people are very successful and they can kind of go after an issue on their own, but it takes a lot of energy and a lot of resources. And what COPA can do for people on the ground in California is provide that voice to amplify the individuals that are involved with the state organization. And so AOPA, once I got to AOPA, I recognized the need to expand our outreach within the states and hopefully, not just from a grassroots effort, but hopefully to build stronger organizations in those states. And I think that COPA is a perfect example of how we've been able to work together to do that. Yeah,
I agree. And just for clarity, COPA normally has a fall educational symposium. The last 2 years, we've held it at Cal State University, Dominguez Hills. And this year we are foregoing that conference, and we are instead working closely with AOPA to combine those efforts and have one meeting, and that's the AOPA annual assembly. So, well, if there are no more questions, then
I might have seen one. I think
there's a comment.
Okay.
It says Robert's asking if non-members would have access to the site.
Oh, so I'm happy to offer a demo. If you want to email me, again, my email address is right here on the screen. If you want to shoot me a quick email, I'm happy to offer you kind of a trial login, and you can test the site out for a week. And then, you know, it is one of our biggest member benefits. So for AOPA, you know, a lot of the resources go into this platform. And the only way that we are employed is if we have members. So it is a members only resource, but I'm happy to provide, again, a trial for anyone that's interested. I think we have one more question. Oh, thank you, Paul, for all your questions. It's been great to help me move things forward. So I appreciate that. Okay, I don't see any others.
All right, Ashlie. Thank you once again, and thank you to all of our participants. Thank you for staying with us throughout the entire presentation. I think that's a real credit to your speaking, Ashlie. So thank you for the quality content. And so,
thank you, Maynard, for having me.
Yeah, absolutely. I was looking forward to it. And if there are no more questions, then we'll adjourn the meeting, and we thank you all for your participation.